So we're fortunate we have a complex peripheral nerve clinic, which is a multidisciplinary clinic with myself and several other surgeons, Dr. D and Dr. Wilson, another hand surgeon and a neurosurgeon. And we collaborate with our physiatry colleagues who also help us to identify patients who have these injuries to their nerves. And sometimes it's things such as simple as carpal tunnel or cubital tunnel, which is kind of the kissing cousin to carpal tunnel. And sometimes it's people who've been in fairly traumatic accidents that have very difficult and severe injuries that make it to where their hand and their arm really don't work at all. So we see these patients, we evaluate them, we have a therapist in our clinic as well, and the nice thing about having several different people from several different specialties is that we're able to really get a comprehensive look at both their diagnosis to make sure that we understand what's going on, and then two, develop a comprehensive treatment algorithm for them, which can include everything from pain management to surgical planning, and then also their rehabilitation afterwards with our trained hand therapist who have some additional training to really know how to deal with patients with these problems and these complicated reconstructive procedures that we do. So some of the things that we do for those patients are everything from nerve transfers, basically these are people who have multiple nerves that are not working, and so they have very little function of their arm. And so we find nerves that are still working, and sometimes we'll take those and use them to power a nerve that's not working, that's critical. Sometimes we take even muscle from their leg and we hook it up to their shoulder and use that new muscle to power their arm and help them to bend their elbow or bend their fingers. And so there are a number of different reconstructive options we have. We tailor it to each patient, and that's really the benefit of having several different people looking at the patient, is we can take these complex challenges and really distill down an algorithm that works for the patient.